A urinary tract infection or cystitis is an incredibly common bacterial infection affecting the bladder, and it affects quite a lot of the population. One of the most important reasons for looking at this as a cause of sepsis is just because of the number of people that suffer a waterwork infection. So the most common symptoms of a UTI are stinging when you're having a pee, potentially a fever, some tummy pain at the bottom of your tummy. Then the more serious symptoms would be blood in your pee, pain in your back, a high fever, so a temperature above 38 degrees, sweating, and nausea and vomiting. For the older population, absolutely one of the key features of a urinary tract infection or any infection is that it can change their mental state. So a person who is normally fairly coherent may suddenly become very agitated, very confused, and appear quite unsettled. It can also go the other way, where a patient would become very withdrawn and maybe more sleepy. Thankfully, most patients who suffer a urinary tract infection, it's either self-limiting, and by that I mean it would settle over a 2 to 3 day period just by drinking lots of fluid. Or it ends up being something which requires antibiotics, which can be freely available from your GP or nurse prescriber at your local practice. So for some people, it comes down to just very simple self-care. So there are, for most of the population, just simply drinking enough fluid over the course of a day, and that's between 2 to 3 litres for an average individual. Actually, fluid can be brought in by the way, so tea and coffee does count. Offering fluids on a regular basis, so that if somebody is not as mobile and maybe their memory is not as good as it used to be, actually just having either a mug or a beaker of fluid next to them so they can drink, which can sometimes be enough to make sure that's topped up. For other patients, actually need to get the fluid in other ways, so you then have to start thinking about what's the person eating. Could you think about soups, yogurts, jellies, anything which has got a high fluid content will help. If you think you've got the symptoms of a urinary tract infection, the first thing is to actually think, is this severe enough that I need to be seeking medical attention? So if you've got any of those worrying features, back pain, high fever, severe tummy pain, nausea, vomiting, then you need to be contacting a medical professional. If not, some self-care advice, so making sure you're well hydrated, making sure that you're emptying your bladder on regularly throughout the day so you're not just weeing once or twice a day. It can be quite embarrassing for some people to talk about this area of health. There isn't a hard and fast rule that you could apply to everybody. What I would say is that if you are a carer, either for a relative or you're working professionally as a carer, when you're managing elderly patients and caring for them, if their behaviour starts to change, if they start complaining, if they're up and down to the bathroom on a regular basis, you need to be thinking, could this be a waterwork infection? That's the first part of diagnosing it actually, and that's the most important part.